Hello and welcome. Today we're diving deep into the heart's incredible electrical system. We're going to break down what happens when that perfect, steady beat goes wrong.
You can think of your heart's rhythm as this perfectly conducted symphony, right? Every single beat is timed just right for maximum effect. But what happens when the conductor misses a cue? Or maybe one of the musicians just starts playing completely out of tune? That is exactly what we're here to explore, the fascinating and sometimes pretty dangerous world of cardiac dysrhythmias.
So before we can really get into the chaos of a missed beat, we have to understand the harmony of a perfect one. We need to know what we're aiming for. So what's our baseline? What does normal actually look like?
And here it is. This is our gold standard, normal sinus rhythm. The rate is a nice, steady 60 to 100 beats a minute. The rhythm is as regular as a ticking clock. And you see those upright P waves? That's the signal telling us the atria, the top chambers, are contracting. It proves the electrical spark is starting exactly where it should. This perfect rhythm, this beautiful symphony, means we're getting optimal cardiac output, pushing that oxygen-rich blood exactly where it needs to go, when it needs to go.
Okay, now for our first bit of dissonance. We're going to move up to the atria, the heart's upper chambers, because this is where some pretty significant disruptions can get started.
So what causes these misfires? Well, take a look at this list. You've got stress, stimulants, electrolyte imbalances. It's a lot of common stuff. I mean, have you ever felt your heart just skip a beat after maybe one too many cups of coffee? That's not just in your head. It can be a real electrical event, a little hiccup, triggered by stimulants like caffeine. These are the usual suspects that can throw the top of the heart out of whack.
Okay, what's so wild about this slide is just the visual difference. It's night and day, right? On the left, you have that steady, predictable beat we just talked about. But on the right, that's atrial fibrillation, or AFib. Notice that wavy baseline? And the P waves, they're just gone. Poof! That means there's no organized squeeze from the atria. The rhythm is what we call irregularly irregular. It's totally random. Essentially, the atria are just quivering chaotically, which is terrible for blood flow and, really importantly, creates a major risk for blood clots and stroke.
This table really breaks down the different kinds of atrial dissonance for us. A PAC, or a premature atrial contraction, that's like a little hiccup, just a single beat that shows up too early. Then you've got atrial flutter with its classic sawtooth pattern. It's more organized than AFib, but it's still a problem. And then there's SVT, supraventricular tachycardia. This is a super fast rhythm that starts above the ventricles, often cranking way past 150 beats a minute. It's what causes that sudden, terrifying feeling of a racing heart.
All right, now we're going deeper, down into the heart's main pumping chambers, the ventricles. And I'll tell you, when electrical problems start here, the stakes get much, much higher. We are now talking about life-threatening rhythms.
And the first huge clue that we've got a ventricular problem is right here, a wide QRS complex. A normal QRS is lightning fast, it's narrow. But when it gets wide, more than 0.12 seconds, that's a massive red flag. It's a visual warning sign that the electrical signal is taking some slow, inefficient, and really dangerous back road through the ventricle muscle itself, instead of the electrical superhighway it's supposed to use.
Just look at this comparison. On the left, there's our old friend, normal rhythm. But on the right, that's ventricular tachycardia, or VTAC. See those wide, totally bizarre-looking QRS complexes? There are no P waves leading the charge, and the rate is just terrifyingly fast, somewhere between 140 and 250 beats per minute. The heart is beating so fast and so poorly that it can't even fill up with blood between beats. This can turn into a major medical emergency in a heartbeat.
So when you're faced with VTAC, here is the absolute most crucial question. Does the patient have a pulse? This slide lays it out perfectly. If there's a pulse, it means the heart is still managing to pump some blood, and we might be able to treat it with medication or a synchronized shock called cardioversion. But if there is no pulse, well, that's a code situation. That means you start CPR immediately and you get the defibrillator. The presence or absence of a pulse changes absolutely everything.
If VTAC is like a dangerously fast and out-of-control drum solo, then ventricular fibrillation, or VFib, that's the sound of the entire orchestra falling down a flight of stairs. It is just chaotic electrical noise. There is no beat, there is no pulse, there is no cardiac output. This is a lethal rhythm, and the only chance for survival is immediate CPR and a powerful electrical shock.
Okay, we've seen rhythms that are too fast, rhythms that are too chaotic, but what happens when the signal just fails completely? What happens when the music just stops?
What this slide shows us is a total communication breakdown. Look at the left.
In normal conduction, every P wave from the atria is followed by a QRS from the ventricles. It's a perfect conversation. But on the right, in a third-degree block, well, the atria and ventricles have had a bad breakup. They're completely divorced. The P waves are just marching along at their own pace, and the QRS complexes are doing their own thing at a different, much slower pace. The conductor's signal just isn't getting through at all.
And this is the ultimate failure. Asystole. You probably know it as a flatline. It's the total absence of any electrical activity. Now here's a huge misconception you see in movies all the time. You cannot shock a flatline. It doesn't work. A defibrillator is meant to reset a chaotic rhythm. But here, there's no rhythm to reset. There's nothing. The only treatment is high-quality CPR and desperately trying to find and reverse whatever caused. Okay, after all that chaos and failure, let's totally shift gears. How do we fix these problems? How does modern medicine actually step in to restore the beat and restart that symphony?
Let's start with that life-saving move we've been talking about, defibrillation. Honestly, it's not as complex as it might look on TV. It's a very clear 4-step process. You place the pads correctly, you charge the machine, you make absolutely sure everyone is clear of the patient, and you shout it out, and then you deliver the shock. It's basically a powerful electrical reset, kind of like turning your computer off and on again, designed to jolt a chaotic heart back into a normal rhythm.
Of course, medicine also gives us this incredible toolkit of drugs. Think of these as highly skilled technicians for the heart's orchestra. A drug like adenosine can literally slam the brakes on a racing rhythm like SVT. Amiodarone helps control the overall rhythm itself, while something like diltiazem is more focused on just controlling how fast the heart is going. And so crucially for AFib, anticoagulants, blood thinners, are used to prevent those life-threatening clots from forming in the first place. Now, when drugs aren't enough for long-term problems like a third-degree block, we can implant a pacemaker, which is basically a permanent backup conductor for the heart. But even these incredible devices can have issues. This slide shows the two big ones. Failure to pace is when the device doesn't even send out a signal, the conductor just didn't show up for work. Failure to capture is when it sends the signal, you can see that little spike, but for some reason the heart muscle doesn't respond with the beat. The conductor's waving the baton, but the orchestra is just ignoring it.
After seeing all the incredible ways this complex system can fail, I just want to leave you with this one number, 100,000. That's roughly how many times your heart's electrical system performs its symphony perfectly, without a single mistake every single day. It really is an electrical miracle, isn't it? Firing with that much precision over and over again. And that really leads us to our final question. Given everything we've seen, all the harmony and all the chaos, what does the rhythm of your own heart tell you about your health? Thanks for joining me for this explainer.